Hello, I'm Bruce Stevenson. I'm the guy on the lower left, and the person on the lower right is Linda Piccinini. And between the two of us, we are today's dental consulting. And this is another one of our little brief videos that we call Open Dental Hacks, although this one doesn't really have anything to do with Open Dental. This one is about the single most important piece of equipment in a modern dental office. So you got lots of choices, obviously, lots of ways to spend your money on expensive computer networks. We love computers. Expensive dental chairs, cone beams, surgical handpieces, CAD/CAM, all those things are really important, but they're not the most important. We think this is the single most important piece of equipment, and yet it's kind of overlooked and taken for granted. And so what I suggest you do is consider this not as your regular old telephone, but as a golden telephone, because this is your first contact with most new patients. And frankly, most dental offices blow it. So let's talk just real quickly about some of these things. That's Jay Geyer on the upper right, and he's famous or infamous for the Scheduling Institute. And regardless of what you think about the Scheduling Institute and their advertising, he makes some really good points. And this is a survey they did of 12,000 offices back in 2012. And what I find is very significant is, first of all, 35% of the time the phone was not even answered. Big problem. Secondly, only a little over 4% of the time did the staff actually try to make an appointment. I mean, that is absolutely appalling. So these are pretty interesting statistics, and I think you can do something to improve upon them. Most businesses, with the exception of dentistry, spend a fair amount of time training their telephone staff. They recognize that this is the golden telephone. But in dentistry, we just kind of assume that everybody knows how to answer the telephone. We may give them a few guidelines, but really not very much. And as a matter of fact, most dental staff kind of get their nose out of joint when we say, hey, listen, we want you to answer the telephone differently. They say, whoa, I know how to answer the telephone. I've been answering the telephone since I was 5 years old, and I've been riding a bike since about the same age. And what we're saying is, yes, it's true. You've been able to ride a bicycle and answer the phone since you were about 5 years old, but we want you to do it a little bit differently. This is the golden telephone we're talking about. And instead of just a regular old bicycle, this is a unicycle. And this is going to take a little bit of training and doing things a little bit differently. It's kind of similar to the bicycle, but it also has some real important differences. So the golden telephone is riding the unicycle. And not only do we want one person in your office to ride the unicycle, we want everybody who answers the telephone to ride the unicycle. Critically important to you. So what do? How do you go about getting your staff to ride the unicycle? The first thing is you need to get some frequently asked questions. Your office needs to come up with some frequently asked questions, 10 most common or 12 most common questions that you hear over the phone. And they'll be a little bit different for your office, although probably most offices hear the same questions over and over again. How does your office answer those questions? I'll bet you different people in your office have different answers. You need to have one set of answers for everybody in your office. And particularly when you hire a new person, a lot of times they're stuck answering the telephone. They have no clue. All they can do is put the person on hold and go find somebody who maybe has some other answer. So first of all, come up with your frequently asked questions. We do have a list that we've come up with that obviously needs to be modified for each office. And at the end, I'll give you Linda's email address and you can request it or just make your own. You don't really need to have ours except maybe as a guideline. So that's the first thing you do. Come up with your written frequently asked questions. Second thing you need to do is eliminate barriers. Sure, you can come into our office as a new patient. Just drive over that boulder first. We put barriers up all the time. So here's an example. Can I come in just for a cleaning? A pretty common question that people get over the phone. And the pretty common answer is no. First, you have to come in for a complete exam with a doctor, an FMX, perio charting, photographs, sign our 50,000 pages of disclaimers and everything else, pay up front, and as a matter of fact, you probably should get a colonoscopy and an MRI too. Oh, and by the way, I can't get you in for about 3 months. Now, would you like to make an appointment? I think you answered your own question right up there at the top. No, I think I'll call somebody else. Thanks just the same. Big barrier. Okay? Aha. Not the barrier to the doctor. He thinks everything's okay. Patient has a little bit different perspective of that. What else? Third thing is use checklists. Checklists are not training. I certainly hope this pilot knows how to fly the plane before she looks at the checklist. But checklists are very good as reminders. Checklists are like shopping lists when you go to the store. It's a reminder. It's not telling you how to get to the store. So you need training, but you also need a checklist. And we have a checklist for the telephone, which Linda will send you if you want, but you can make up your own. Here's ours. It has 7 different things on there, 7 different steps to train the office staff in how to answer the telephone. Okay, this is a learned skill, or at least it can be. So, I answered this question hopefully. What's the single most important piece of equipment in the modern dental office? It's the golden telephone. But more than just the golden telephone. It's the skill to use the golden telephone. You have to have staff training, whether it's the Scheduling Institute, whether it's us, whether it's somebody else, whether you do it yourself, it doesn't really matter. But the staff has to be trained to think about that telephone a little bit differently and to think about answering that telephone a little bit differently. So I hope that was enlightening a little bit. If you want more information about what we do, you can call Linda, or you can just email her down there at the email address on the bottom. And if you just want those 2 things mailed to you, the checklist and the FAQs, she'd be glad to do that also.